Hi everyone. For my behavior change proposal, I am working with an 8-year-old boy diagnosed with autism spectrum disorder. I currently have access to this participant through an ABA clinical setting where he receives therapeutic services 5 days a week, 9.5 hours a week, and this is across 3 therapists as well as his consulting BCBA. The target behavior for decrease is repetitive manding, which is currently defined as vocally manding using 1 or more words 3 times or more for the same item, activity, or person within 15 seconds. This may or may not include tear production and or whining. So an example of the target behavior would be manding for the iPad 3 times in 15 seconds. The reason that I chose this for the target behavior is because I would like to help him build more social opportunities within the clinical setting between himself and peers, as well as staff members, and I'd like to be able to focus more on acquisition programming to help improve his overall functional skill set. And repetitive manding has been so significant in recent months that it has been impeding all of these opportunities for him to move forward. As far as the IOA, we're going to be calculating it myself with the various direct treatment team members across 30% of all the sessions. I'm going to be using exact count per interval IOA. For his baseline data, which we're still in the process of taking, we're going to be taking it for the first hour and a half, and this is across all sessions. The intervention itself proactively will start off with a visual schedule to be made with him every day, as his routine is very flexible every day to help with his generalization. And he will be asked to go over the schedule and read it aloud once it's been completed. If he mans for a currently unavailable item, activity, or location, we're going to use a point prompt referencing the time on the schedule when that will become available to him. As he's had ABA services for a number of years, he's very familiar with first then language, so we're going to provide clear expectation statements with the use of that. And we're also providing a token economy system. He'll have 5 tokens to earn to gain access to preferred items or potential reinforcers. We're going to start it off on an FR1 schedule and move to a variable ratio schedule. This is, as far as I know, his first encounter with a token economy system, so it is going to take a little bit of teaching. We're going to be using a least to most prompting hierarchy to teach him the placing on of tokens as well as the removal. Consequence for engaging in the target behavior of repetitive manding will be response costs or the loss of 1 token per occurrence within an interval. We are using partial interval data collection system with this. The experimental design is a multiple baseline design. This will be across therapists. I chose this because I think that it will help show us if he's really generalized the skill across staff members, which his history shows has been an issue for him. So we're still in the process of collecting baseline data. There are a couple things that I'd like to get reapproved so that we can conclude our baseline phase. Just a couple things with the definition, operational definition itself that I'd like to tweak. But beyond that, I'm very excited to start the intervention because I think that decreasing this repetitive manding is really going to help this client in his academic programming.